Well, phthalates are back in the news again. These are substances that are found in an awful lot of the products that we use every day, and they're ubiquitous. They're all over the environment. They're used to soften PVC, okay, that's polyvinyl chloride plastics, and they're especially common in hospital products. They mimic estrogens. They're called xenoestrogens. They cause neurological defects and liver cancer. We know that. Now there's an article coming out in Diabetes Care in April of 2012 showing that phthalates are linked to the increased incidence of type 2 diabetes. My goodness, what does it take for us to get the idea that these substances should not be in the environment at all? What they found in this particular study is that there was a modest elevation, about a 2 times risk for type 2 diabetes. And they did this by studying 1,000 people who were about 70 years old in Sweden. And what they found was that were abnormalities in blood sugar and also a disruption of insulin production. It's interesting that we talked just a couple of weeks ago about the fact that that compounds like this, toxins like phthalates, can cause transgenerational effects, meaning that it's not just us if we're exposed to it, but it's generations down, maybe 2 or 3, that are affected by the effects of phthalates. Hard to believe. We also know in a recent study that BPA, which is very similar to phthalates, increases the risk of heart attacks by 33% over a 10-year period. The Environmental Working Group has done a lot of studies on things like phthalates. In fact, what they did is they studied 9 people scattered throughout different parts of the United States and looked at their blood and urine and tested for 210 different toxins. There wasn't a single person who didn't have phthalates in their body. Amazing. Now, our U.S. Congress has done a little something. It's restricted the use of 6 of the phthalates in kids starting the year 2008. But we've just touched the tip of the iceberg. We bring these kinds of chemicals forward because they have practical applications that seem to make sense, but usually before we've tested them. And this is just another example of that. So we look at things like BPA, and we're looking at phthalates, and we're looking at dioxins, etc. And we just look at one thing, one of those chemicals, and the effects it has in the human body. What do you think would happen when there's 2 or 3 or 20 or 50 or 100, which is what we're finding there is? You wonder about the epigenetic effects of our environment that changes our DNA and changes our genes and changes the way they express themselves. It should be obvious that things like cancer are very much related to this. It's no big secret about what causes cancer. It's an epigenetic disease. So when we're looking at things like phthalates, we need to do something at the national level. And thank God for people like the Environmental Working Group who's publishing data about it, because we've got to get these chemicals out of the environment so we and our kids can be healthy.